Welcome back to Nurs 238, Classification and Management of Mental Disorders. We continue with the dissociative disorders. And this time I want to look at dissociative identity disorder. Dissociative identity disorder was formerly called multiple personality disorder. It is characterized by the existence of two or more personalities within a single individual. Only one of the personalities is evident at any given time or moment, and one of them is dominant most of the time over the course of the disorder. The transition from one personality to another is usually sudden, often dramatic, and usually precipitated by stress. Different personality types may also exist in which one is talkative and extroverted and the other shy. Example, a normally shy, socially withdrawn, faithful husband may become a gregarious womanizer and a heavy drinker with the emergence of another personality. They may or may not be aware that other identities exist. The disorder is most common in adolescents and overwhelmingly also develop in women. It can also develop in young children. Dissociative identity disorder is the most severe and chronic of the dissociative disorders. Recovery is difficult and usually incomplete. Medical treatment. Insight-oriented psychodynamic psychotherapy is the most effective approach to this disorder. Antidepressants and anxiolytics may be useful to treat associated psychiatric symptoms. Hospitalization may be required for suicidal or impulsive behavior. Nursing management. Assess suicidal or harmful intent. Discuss consideration of a plan and availability of means. Assess sudden changes in behavior. Help client identify stressful precipitating factors that initiate emergence of the suicidal personality. Establish trust and secure a promise that clients seek out support when self-destructive impulses are present. Seek assistance from another strong-willed personality to help control the behavior of the suicidal personality. Assist the client in identifying alternative behavior to self-destructive behavior, for example, verbal or written expression, physical activity. Place in isolation or provide physical restraint in a non-punitive manner to ensure client safety when internal control fails. Assess physical and emotional status every 15 minutes while in restraints. Client safety and security are nursing priorities. Administer antidepressant and anti-anxiety medications as ordered by physician. The next disorder we want to look at is depersonalization disorder. Depersonalization disorder is characterized by a temporary change in the quality of self-awareness. So in depersonalization disorder, there is a temporary change in the quality of self-awareness, which often takes the form of feelings of unreality, changes in body image, feelings of detachment from the environment, or a sense of observing oneself from outside the body. Depersonalization is differentiated from derealization, which describes an alteration in the perception of the external stimuli. Let me take this one again. I said depersonalization, that is a disturbance in the perception of oneself, is different from or differentiated from derealization, which describes an alteration in the perception of the environment. So derealization describes an alteration in the perception of the external environment, and depersonalization is a disturbance in the perception of oneself. Both also occur in a variety of psychiatric illnesses such as schizophrenia, depression, anxiety states, and organic mental disorders. So depersonalization and derealization can be signs and symptoms found in many psychiatric disorders. It is estimated that approximately half of all adults experience transient episodes of depersonalization. The diagnosis of depersonalization disorder is not made, even if episodes are recurrent, unless the symptom cause social or occupational dysfunction. In depersonalization, patients feel like they are observing themselves from a distance rather than fully participating in their action. The feeling that one is not oneself, experiencing or feeling that one is unreal. If derealization is present, objects in the environment are perceived as altered in size or shape, a feeling that things in the environment have changed or no longer real. The disorder has been found to occur at least twice as often in women as in men, and is a disorder of younger people, rarely occurring in individuals older than 40 years of age. The disorder may follow a chronic, unremitting course of many patients. Let's look at the nursing intervention or the nursing care as far as depersonalization is concerned. Otherwise, what should a nurse do when such a patient is admitted in hospital? Provide support and encouragement during times of depersonalization. Clients manifesting these symptoms may express fear and anxiety at experiencing such behaviors. They do not understand the response and may express a fear of going insane. Explain the depersonalization behavior and the purpose they usually serve for the client. This knowledge may help to minimize fears and anxieties associated with their occurrence. Explain the relationship between severe anxiety and depersonalization behaviors. Help relate these behaviors to times of severe psychological stress that client has experienced. The client may be unaware that the occurrence of depersonalization behavior is related to severe anxiety. Exploit past experiences and possibly repress painful situations such as trauma or abuse. Traumatic experience may predispose individuals to dissociative disorder. Discuss these painful experiences with client and encourage him or her to deal with the feelings associated with these situations. Work to resolve the conflicts these repressed feelings have nurtured. These interventions will serve to decrease the need for the dissociative response. Discuss ways the client may adaptively respond to stress and role play with him or her to practice using these new methods. Maintain a calm, non-threatening manner while working with the client. Anxiety is contagious and may be transferred from staff to client or vice versa. We continue with the nursing interventions. Reassure clients of his or her safety and security. This can be conveyed by the physical presence of the nurse. Do not leave the client also at this time. Use simple words and brief messages, spoken calmly and clearly. Explain to client what is happening. Assure the client that experiencing of depersonalization behaviors does not mean that he or she is going crazy. Explanation should offer some relief. When depersonalization behavior have diminished and anxiety has been reduced, explore with the clients the stressful situation that may have precipitated the response. The occurrence of depersonalization behavior is related to severe anxiety. Discuss with the client ways in which he or she might respond to stressful situations that will be less likely to result in depersonalization behavior. And finally, use role play to practice new, more adaptive coping strategies. This brings us the end of the last session in Nurs 238. So this brings us to the end of Nurs 238, and just watch the videos and read the slides, and I'm sure you do well at the end of semester exams. Thank you so much, and I wish you well. Bye-bye.